In Health and Wealth, a closer look at how corporate America is responding to mental health issues. It's a pleasure to have with us today former Congressman Patrick Kennedy, who has authored a book about his struggles with mental illness, and Paul Gionfriddo, who lost a son due to mental illness. We thank you both for being here. How do you think corporate America is handling and responding to this crisis?
I think more members of corporate America are understanding the mental health needs of their employees than ever before. And there are quite a number of them that are stepping up and recognizing that in this new workplace that we've got, where we're going to have some people in person, many hybrid, and some continuing virtual models, that their employees need to be supported. And if they do support their employees, it pays off. It pays dividends on the bottom line for them.
Do you find that the federal government is responding to your message?
I think the federal government obviously needs to step up and make sure that everyone in America knows that in responding to COVID, we're responding to not only the incidence of pulmonary distress, but mental distress. We're seeing deaths result of COVID, higher suicide, higher overdose. And of course, we're seeing the deaths that you see portrayed on your evening news. Both are deaths. So let's not mistake that one is the only symptom of COVID. We need to be mindful that mental health is part of overall health, and any response to COVID needs to include both mental health and physical health response.
You are working on a plan, and how do you think it will improve the situation?
Well, we need to put a lot more investment into mental health. For example, in the COVID relief plans that have already passed, we got about $4 billion, which is about $4 billion more than we've ever gotten before. And in the one that we expect to pass in the next couple of weeks, we'll get another $4 billion, which again is now going to be about $8 billion more than we've ever gotten before. But I think Patrick and I have been out there saying that we've got to go times 10 or times 100 on that number, really, to get a handle on all of what we need to do, because these issues are starting when kids are in school, and they continue through the lives of young adults trying to get into the workplace. And we can't continue to ignore that and wait for crises to occur. If we're going to make an investment in mental health, we need to make the investment upfront and early and continue it throughout people's lives. Otherwise, we're going to be experiencing more mental health catastrophes like we have during the last year, where literally half the population is now dealing with diagnosable depression or anxiety.
We wish you the best with your mission, and thank you for your time.
Thank you, Angie.
Thanks, Angie.
This is First AM. Check us out on social media. We're on Facebook, YouTube, and Twitter. And go to businessfirstam.com for where to see our show on TV.